Hello, this is Harvania Perkins, and I'm taking a moment to do Volume 4 of my Harvania's Helpful Hints for Clinical Research Professionals. Actually, today I'm going to talk about what I feel is the most important part of what we do as clinical research coordinators. I always tell my staff that what we do is we sell good data. And so the way to sell good data is to collect good data. So this Volume 4 is about preparing for your subject visit. Your subject visit is where we collect all of the information that we need to enter for the sponsor. So it's very important to be prepared to collect all of that data. So usually the day before, what we do is we call the patient to remind them of the visit. When we remind them of the visit, we check to see if there's anything that needs to be required for that visit. If they need to be fasting, we remind them to be fasting. If they have some diary entries that they need to collect, for example, if they had to do for a diabetes study, if they had to do a 7-point blood sugar collection, we look to see if they've completed that before their visit. If they haven't completed it, then we reschedule the visit so that we can have that done within the visit window. Also, if there's any overnight urine collections, that's a common one. We make sure that they're reminded to collect that then prior to their visit. So also in the preparation for the visit, print out your visit sheet, look through that sheet, make sure that, double check it with the protocol, make sure that you have all of the required entries to collect all the data that you need to collect in the proper way. If you're doing procedures like EKGs and blood pressure, make sure that you're collecting those in the proper way, whether it's sitting up or supine or after a 5-minute wait or a 10-minute wait, so that you can do what is specified by the protocol. So you print the visit sheet. You also make sure that you have, if the patient has any questionnaires they have to complete, you have that ready. Check to see if there's a need to do informed consent. If so, have that printed out already. And a clipboard, have a clipboard for the patient because it's easier for them to sign anything if they have a clipboard. Also, make sure that you pull the lab kit to make sure that you do have the lab kit for that visit. If you're building a kit, or make sure that you have contacted the central lab to see what their requirements are on building a kit, or what to do if you don't have the specified kit for that visit. Also, you want to make sure that you have, if there's a urine collection of that day, fresh urine collection, that you have a urine cup there, so that you want to have everything that you may possibly need for that patient visit, so that you're not doing a whole bunch of running around in and out of the room. Because like I said, when you have that contact with that patient, you want to be fully engaged with that patient while you're in there, and not keep going, oh, I forgot this, and oh, I forgot that, or I forget this. And that's a way that we end up missing things and skipping procedures when we're not prepared for it prior to the visit. So if you have all of that stuff set up before your visit, then you know that when that patient comes in, that you can just grab all of those materials together, take them to the room that you're supposed to take them in, and that your visit will be able to go smoothly. Also, on the day before, when you're looking at the visit, make sure that you have adequate space and adequate time for all of your patients. If you see that you have too many patients and you won't be able to manage them, or you don't have enough rooms for them, go ahead and see if some can come earlier, or some can come later, or maybe you can move them to a different date. I have one study where the patients come in every 6 months, and one of the patients asked me one time, he goes, you know what, this is like the 3rd visit that you've rescheduled. And I told him, well, we have a whole month to get you in your visit window, and some studies only have a couple of days, so it's easier for me to move you than to move somebody else. And he was just like, well, I was just wondering. He didn't have a complaint about that. That was just what he remarked. But he did appreciate that, because he did appreciate me being able to take care of him in a timely fashion for his visit. When you try to stack the schedule and you try to, oh, we'll work them in, you always end up having people having long waits, and that's when procedures get missed and skipped. So do yourself a favor. I keep saying that a lot. Do yourself a favor, make it easier on yourself, and be adequately prepared to collect the information that you need to collect. Thank you.